Let's take a brief look about the regeneration process of the nerve. As you can see, from the site of injury, there is no more physical connection between the nerve, soma, the body of the... I often interchange nerve and nerve cell, but I hope you will forgive me that. When I say nerve, I mean motor neuron, so nerve cell, which is connecting the brain with the muscle fiber. So when it's physically interrupted, as you can see here, the second stage is that the immune system clears up the site, so the regeneration can take place without any disruptions. Then from the soma, from the cell body, which is intact, as we already know, it still remains intact inside the brain, the regeneration of the first of the axon of this shaft takes place, and at the same time the body sends stem cells to proliferate into the Schwann cells so they can form a myelin sheath around the regenerating axon. As you can see, neurolemmacytes proliferate and axon grows in the direction of its target. Here it is very important that we take a closer look about what is very popular concept or hypothesis about the cause of facial synkinesis. The most widely spread and accepted opinion about the cause of facial synkinesis is what's called aberrant regeneration, which means that during the regeneration process, these axons have chosen the wrong target and have reconnected to the wrong muscle. Well, from our point of view, the actual cause of facial synkinesis is not aberrant regeneration. Why we'll discuss just in a few slides. So we'll assume that after damage, the axon will regrow back and reconnect to its own muscle fiber. And when it's done, then the signal starts coming back again to the muscles, to the muscle fibers, and the victim or the sufferer of the facial palsy starts to experience certain movements. First, it's some vibrations, some tickling, some maybe semi-spasmodic movements of certain fibers, and then it becomes bigger and bigger and larger, and step by step the muscle regains its ability to function, to contract and relax. Let's talk about complications and residuals, possible complications and residuals of facial palsy that may occur, may develop after long-standing facial palsy. We are talking now about long-standing facial palsy, which means the palsy which has not recovered within short time, let's say 1.5 to 5 weeks, that took longer time for recovery, when the first movements have started to return more than 3, 4, 5 weeks after the onset. And in this case, quite often, more often than not, some residuals and complications remain or then develop, which pretty much complicate the life of a person who has been affected by the facial palsy. Let's take a brief look, and then we'll take a little closer look later on. Synkinesis. Synkinesis, it is an synkinesis, moving together. It is the involuntary involvement on certain muscles during facial movements, and these muscles do not normally participate in normal facial movements. For example, as you can see here on the pictures, the lady here, she wants to smile and her eye becomes smaller because involuntarily, because the palpebral part of the circular muscle of the eye involuntarily contracts, and as you can see here, instead of going up, her mouth corner goes down because of this muscle depressor anguli oris, the muscle that depresses, that pulls down the mouth corner, is involved. So because it's stronger, apparently it has recovered in a higher degree than the zygomatic muscles of this patient have recovered, and that's why instead of going up, the mouth corner is being pulled down. Same here, you can see dimples on the chin. Very similar here and here and here. These all examples of synkinesis while person is smiling. Sometimes also platysma, surface muscle of the neck, is being involved. So that's the synkinesis can have very many manifestations involving various muscles of the face. It can be synkinesis which involves the frontal muscle, the eye muscle, the zygomatic muscles, the platysma muscle, the chin muscle, many muscles. The variations are quite numerous. Contractures of facial muscles. Contractures, what is contracture? Contracture is a contraction of the muscle which does not relax. It has contracted to a certain degree without cramping and has not relaxed. And it happens not because anything is wrong with the muscle. It happens because the muscle received or receives a signal from the brain through the recovered or partly recovered facial nerve fibers to contract and to remain in a contracted state condition. So it's most of the time the contractures, not contractions, again, contractures are not depending on the muscle which is contractured. They are not depending on the nerve which is regenerating or has regenerated at least partly, but they are mostly contracted. This is our point of view, by the way, here in the clinic. But they are related to some signals coming from the brain to the facial nerves, and these signals have developed, there's a habit to send those signals, have developed in the mimetic center of the brain, the center that manages our mimetic movements at will, volitional center so-called. And these signals are there and they provide for these contractures, which you can see here. The nasolabial fold is much more pronounced on the affected side than on the healthy side. And very often also patients complain that even in the neutral state, the affected eye looks smaller because the eye fissure is more narrow on the affected side than on the healthy side. And that's on account of contracture, or at least partial contracture of this palpebral part of circular muscle of the eye, which is contracted and would not like to relax. Again, this is not forever. It is reversible. We just need to do certain things and to re-teach, so to say, our brain how to send proper signals to our facial muscles without disruptions, without irregularities, and without imbalance. Facial pains. I have already touched this topic briefly. Facial pains after facial palsy, after a long-term recovery, it doesn't happen with every patient, but good half of the patients have various degrees of facial pains, either spontaneous pains or when we are touching our face or head with our finger or anything else touches. These pains have, again, in our philosophy, from our point of view, have the origin, what is called micro contractures or micro cramps, so to say. What I mean by that, not the whole muscle cramps, not the whole muscle becomes hyper contracted, but certain fibers receive such an intensive signals for contraction, because we know that, by the way, I forgot to tell you, I'm sorry, that in the facial nerve, although it's only 1 millimeter thick, less than 1 millimeter actually, it's a quarter of a safety match in the thickness. It contains 10,000 fibers, of which about 3,000 are sensory or sympathetic, and 7,000 fibers, they are sending signals for managing of our facial expression. Just such little nerve, and 7,000 separately acting, separately functioning wires, each of which is carrying its own unique signal. That's why we can manage so richly our facial expressions. Coming back about those 3,000 wires of sensory and parasympathetic, the sensory wires are providing signals from the tongue, from the first 1/3 of the tongue. So that's why when facial palsy happens, we may lose taste sensation or have a weird one from on the affected side. And the other part of the fibers is providing functioning of the lacrimal gland, the gland here, which produces tears. That's why very often after facial palsy, we either have a very dry eye, so no tears at all, or we have a very intensive, excessive tearing of the eye because the lacrimal gland does not receive proper signals and either produces excessive amount of tear liquid or none at all, or very little for that matter. So coming back to facial pains. So when these micro contractures, micro cramps become numerous, then those pains, which may very often be experienced either like cramps or like bruises, like if your face were bruised, with a blue spot on your face, are actually the result of these contractures. And again, these contractures are resulting from improper signals arriving from the brain. And this, again, we can work on that, and that's also what we are doing with our patients. And facial pains either reduce or completely disappear within a reasonably short time. And of course, you know that if you have cramp, it makes no sense to take painkillers because it's cramp. The pain is so intense that painkiller would not help much. That is why very often the patient takes higher and higher and higher doses of painkillers, trying to combat the pains. But we have to realize that painkillers, they do not eliminate the cause of the pain. They only affect our brain pain centers in the brain to receive signals. So they just dampen the signals of pain that arrive to our brain, but not more than that. But the cause of the pain remains without changes. Asymmetry of facial expressions, again, arises from imbalance in the functioning of the muscles, which in its turn comes from incomplete recovery of facial nerve and certain also processes in the brain which lead to out of balance management of facial muscles. One muscles receive excessive signaling, excessive stimulation, the other muscles receive normal one. That's why we see asymmetry. Weakness of facial muscles, same story. If the recovery, regeneration of the corresponding branch of facial nerve is incomplete, then of course the muscle out of, let's say, 300 fibers has only 55 active. That's why of course it's weak, so it cannot do its job properly. And that's another reason why by the end of the day the person whose recovery has been incomplete may experience additional pains or very tired feeling in the face, and also emotional exhaustion. Why? Because our facial muscles are not only receiving signals from the brain to the muscles, but also the opposite is true. It goes through the other nerve, trigeminal nerve, but our brain also knows what kind of expression our face is making. And because of that expression, our brain experiences changes in emotional condition. That is why very often, if the facial expressions of the affected individual are out of balance, he or she experiences also often emotional exhaustion and also physical exhaustion, because emotional exhaustion leads as its result to physical feeling exhausted and tired. Excessive tearing, we have spoke about it already, so I will not elaborate on that too much. Let's have a quick look at the traditional therapies that are used to treat facial palsy. I have to say that most of the time, most of the therapies are aimed at treatments of facial palsy in its acute phase, which is very logical. And some of them are aimed at reducing the symptoms of complications and residuals also for the long-standing facial palsies. First, foremost, of course, physiotherapy. Facial exercises, they're called in Holland, in the Netherlands, mime therapy. They're called neuromuscular re-education or neuromuscular retraining. Neuromuscular retraining is a term that uses Jackie Deals, who is from Wisconsin in the United States. And neuromuscular retraining is the term which is used by Jesse van Sveringen from University of Pittsburgh. These exercises, these techniques, they use various degrees of facial exercises, pronouncing letters, making some facial movements, some of them with, some of them without application of botulinum toxin injections. And that's what is recommended by most of the doctors, most of the specialists to do either immediately, or some of them only recommend to start doing it only when the very first facial movements have started to reappear. Logopedic techniques very similar to facial exercises, but they are more oriented at pronouncing certain letters, certain sounds, making certain very controlled movements with our articulation apparatus, so to say, with the mouth and so on. Facial massage, very good aid to improve blood circulation and to improve all the processes that are taking place in our neck, head, and face area, because facial massage has a lot of impacts, one of which, the most important, is that it dilates the capillaries, dilates the blood vessels, so the stream of blood, fresh blood, arterial blood towards the damaged areas is increased, and also removal of the metabolic products, CO2, through the veins and also venous capillaries is also increased, improved. So the whole process of regeneration is running more actively. Acupuncture, also very good technique, very good method to improve the general resistance of the body, to improve the energy levels, to improve the balance of the body functioning, and of course to improve the function of the organs. I do not know, maybe there is one, but I confess that I don't know any techniques. They are especially developed to address only facial nerve. There are, of course, techniques and combinations that are aimed at improving the general condition of the face and the head as such, but I do not know any special techniques that are only aimed at one single nerve of our body, which is facial nerve. Electrical stimulation. As far as I know, in Europe and most of the time in the United States and also in Australia and maybe some other countries, electrical stimulation is hardly used any longer, because it's first, it's painful, or pretty much uncomfortable, and secondly, there has been a few scientific papers that have concluded that electrical stimulation may facilitate forming of synkinesis. Nevertheless, in some parts of the world, in some countries, the electrical stimulation is very widely used and prescribed for the patients. Personally, I and also we here in the clinic, we do not agree with electrical stimulation as a effective remedy against or aid to facilitate the recovery, for a simple reason. I will try to explain it in a very simple manner. If we compare our nucleus, the root of our facial nerve here in the brain, as electric switch, our facial nerve as the electric wire, and our facial muscle as a bulb, a light bulb, then when the wire is damaged, it makes no sense to shake the bulb, which is muscle, which is being shaken by the electrical shocks. You have to repair the wire instead of shaking the bulb and expecting that the light will come. That's maybe a little primitive, but at least I hope it's a clear explanation of why I think that we think, I'm sorry, I keep saying I, but it's not I, it's we, because we here in the clinic, we are involved in all processes and discussions and scientific work. That's why we think that electrical stimulation would not help. Surgical interventions. As I mentioned, in some cases, surgical intervention is inevitable. In some cases, it is advisable. In some cases, it is unnecessary. But in any case, it is up to your doctor, up to your neurologist, and up to your ENT specialist, together with you, of course. You are at the end of the day, you are a deciding party. Your word is final, whether to apply or not apply surgical solutions. In some cases, with minimal intervention, they can put a golden weight in the eyelid to make closing of the eye more easy when the recovery of the circular muscle of the eye is incomplete or very little of it in any case. Grafts, nerve grafts, and muscle flap transpositions and so on, they're all cases that will provide certain degree of reanimation of the facial muscles, but we have to realize that this will be definitely not 100% recovery, not 100% reanimation of the facial movements, and there will be, of course, certain asymmetry between the affected side and the healthy side anyway, because natural way of managing is much more complex, much more rich, and much more sophisticated than the other ways which are resulting from surgical interventions. And the last line here is the Botox injections. I already spoke about Botox. Botox is a very effective technique. Botox application is a very effective technique if we want to achieve, first, quick, and second, temporary symptomatic relief from certain irregularities that develop as a result of long-standing Bell's palsy. Quite often, injections of Botox are applied as a remedy against the synkinesis. So into the synkinetic muscle, they inject a few units of toxin just to decrease the level of contraction of that muscle during the synkinetic movement. Sometimes they inject botulinum toxin into the healthy side just to make face look symmetrical. Well, although Botox injections are very good as symptomatic aid, Botox injections do not remove the cause of synkinesis, and they do not remove the cause of contractured muscles, because, as we know already, well, at least we think about that is the case. The source of most of the irregularities is in the control tower of our mimetic movements, and that is in no way affected by injections of botulinum toxin.